Well, the Omicron variant has magnified the dilemma the parents are facing with regularity these days.
So how do you know if your child has COVID or a cold, and when do you keep them home? New this morning, John Shumway joins us with some helpful advice.
Yeah, this is very incredibly frustrating and a very disruptive decision on the home front. And pediatrician Dr. Adam Keating fully understands.
I think it's important to acknowledge just how difficult this is and just how tired of this we all are. This is all making our lives much more difficult.
Because isolation and quarantines require a major upheaval of schedules at home. Add to that the confusion of just what you're dealing with.
We have had, in the past, talked about kids going to school with a little bit of a runny nose or a cough. And unfortunately, with COVID right now, it's really hard to tell the difference between those symptoms and other respiratory viral symptoms.
Dr. Keating says use the old guidelines as a decision starting point.
Anytime a kid's got a fever, anytime they're feeling ill enough that they're not going to be able to participate in school or have increased resources being used by the school staff in order to keep them comfortable or alert, they should stay home.
But, he adds, don't just keep them home.
Any kid who's having a new onset of fever, runny nose, cough, congestion, muscle aches, loss of taste or smell, that they get evaluated by their healthcare provider.
And Dr. Keating says those at-home tests need to be used with a wary eye. And some kids really don't need to be tested at all. We'll tell you who doesn't need to be tested and the concerns about those home tests coming up.
And John, what about sending kids back to school with mild cold symptoms?
Yeah, Dr. Keating says as long as they can function and mask up to protect all the other kids around them, as long as it's a mild cold, it actually should be encouraged to get them back in school.
Yeah, I'm sure that's a question on many parents' minds, so great information.
Thanks, John. Good to have you back.
Thanks.